Hello and good evening, everyone. Welcome to 365 Live. Yes, you're in the right place. My name is Gary, and I will be your host for tonight's live session. So 365 Live is a platform where we educate the public on cancer and encourage a cancer prevention lifestyle. So whenever you see this logo, you will know that 365 Cancer Prevention Society is currently having a live broadcast. So tonight's talk is on the signs and symptoms of common childhood cancers in Singapore. And this is especially brought to you by 365 Cancer Prevention Society and our esteemed medical partner, Icon Cancer Center. So the Icon group brings together medical oncology, radiation oncology, chemotherapy, compounding and pharmacy, hematology, and cancer research to deliver an end-to-end cancer care. And for us, 365 Cancer Prevention Society, we've been committed to serving the community through holistic cancer prevention measures since 2003. And this is accomplished through health and nutrition education, promotion of lifestyle, and our lymphatic detox exercises. So lymphatic detox mixed together, lymphatics exercises. We also provide practical and emotional support and care for our clients and their family members in their battle against cancer through our residential and hospital visitations, through the counseling services, nutrition consultations, and wellness services. So please take a moment right now to like, share, comment on our social media pages, and of course, keep in touch with us for our latest updates for our events and activities. Now, speaking of events and activities, before we begin, I want to introduce a couple of amazing things that's happening right now. So Bloom for Hope is coming up just around the corner. So an exciting event, 365 CPS Annual Bloom with Hope event will happen on the 2nd and 3rd of March at our Tampines hub. So for more information, screenshot this page that you see here, and of course, head over to the website that's pinned in the comments below. And you can go and check that out and do help and support us in raising funds and, of course, bringing awareness to cancer. Now, the second thing I want to share with you is our screening campaign. So my first colonoscopy and my first mammo, that's happening again, and it's back. Now, as you may know, early detection is key in fighting cancer. So again, together with our esteemed partner, Icon Cancer Center, we're currently providing fully sponsored mammograms and colonoscopies for individuals holding a blue or orange CHAS card. So going forward, these screenings are going to help detect cancers at the earliest stages, maybe even before symptoms, and that could definitely lead to better treatment outcomes. So if you are keen to support these initiatives and to fund the screenings, please feel free to take out your phones, scan the QR code that you can see on the screen to donate as well. All right. And I'd love for you to just take a few minutes to do so, because any donation, small or large, is going to go a huge way in helping a child or a parent, a brother, sister, caregiver around you receive the treatment and the support that they need. So please, yes, do give generously too. Now, as we move to the highlight of tonight, please just note that all the information shared at this event by the speaker and 365 CPS are for general information only, and they may be subject to changes too. So please do consult your doctor for your personalized and detailed medical advice. Now, the juicy part. So it is my absolute pleasure in a moment to introduce tonight's speaker. She's a senior consultant in pediatrics. So she's a pediatrician and a pediatric hematology oncologist with more than 20 years of clinical experience in private practice. She's also published several studies in the Journal of Clinical Oncology, Cancer and Pediatric Blood and Cancer journals, and in addition to the local medical journals too, and it's all focused on childhood cancers in Singapore. She has previously also served as a clinical tutor and an adjunct assistant professor and guest lecturer at leading universities and medical schools here in Singapore. And tonight, our esteemed speaker will be speaking about the signs and symptoms of common childhood cancers. So please help me introduce our amazing speaker tonight, Dr. Lele Ang.
Hi, Gary. Thank you so much for all the kind words. Nice to see you tonight.
No, that's just you. And thank you so much for being here this Saturday evening and your willingness to share all of your amazing knowledge with us all here tonight. You know, I actually had a patient who came and see me today. This is the second time that I've seen her in a very long while, and she's really shaken up. And she just, told me very briefly that her son was recently diagnosed with leukemia. And I can see that the toll that this is having on her, just physically and mentally, and energy and everything. So I know tonight's gonna be valuable. But actually, what is the most common childhood cancer?
Yeah, so it's a very good question, and I'm so glad that you are available to support your friend, um, both medically as well as emotionally. So I think it will help her a great deal. The most common cancer in children actually is acute leukemia, and you will learn, and I will share with you that it is highly curable.
Fantastic. I'm so glad to hear for her sake, for her son's sake, but also for everybody here. And I assume you'll be sharing how we can maybe reduce our risks so we don't even maybe get it in the first place.
Yeah, so I will share this with you, but sadly, unlike adult cancers, we don't have simple tests, screening tests like mammograms and colonoscopies. So I hope to share a little bit more about how we can learn to help our friends, colleagues, and neighbors if there are some worrying signs and symptoms in children.
Wonderful. So thank you. So everybody get your pens and paper ready or your fingers, your thumbs ready to type fast. Okay. I'm going to hand over the time to you, but actually wait, before I go to the viewers, if you have any questions, please, please, please just chuck them, post them into the comment section. We are definitely going to get to them. And Dr. Ang has got a wealth of knowledge that you would love to tap onto. So right now, please let me hand over the time to you, Dr. Ang, and take it away.
Thanks, Gary. So similar to what you were just sharing about your friend, 6 months ago, I saw a 20-month-old baby who was referred to me by his pediatrician because she felt an abdominal mass. At that time, he was 18 months old and he just came for a well child care check. So there was nothing particularly wrong. It was just a regular checkup for routine vaccinations. He was growing very well. He was very active. He didn't have any pain. But when the pediatrician examined his tummy, she felt that maybe there was a mass. So she thought it's probably constipation, but hey, there's something about this. Just go and get an ultrasound. So life kind of went on because he is so active. He loves to eat. He is a foodie by parents' word. And the parents didn't notice anything particularly worrisome until a few weeks before they came to see me. They thought the tummy was getting much bigger too fast. And that's when they did an ultrasound and it showed a tumor in his kidney. So tonight, I hope to equip you the next time that you hear from a neighbor, a colleague, a friend, or even you yourself observe some worrying signs and symptoms in a child and when to seek the care of a doctor. It is still a big mystery for all of us as to why and how children get cancer. We know for sure, though, and we are certain that the children did not do anything wrong to cause this cancer. What we do know is that there are some signs and symptoms we can kind of educate ourselves and our neighbors and our families to alert themselves and to seek medical care when it's necessary. I will kind of first start out by sharing background introduction on what is cancer in children and globally and what is cancer. And then I will kind of share what are the common cancers in children and some of the signs and symptoms to watch out for. And we will wrap up the night with a Q&A session at the end. And I hope you will have lots of questions streaming to Gary so that we can discuss a little bit more. What is cancer? Our bodies are made up of millions of tiny little cells. As you can see, the picture on the left is a picture of a normal cell. It's very beautiful and perfectly shaped. Our bodies are making these new tiny cells every day. And most of the time, our bodies are making very healthy, normal cells that help us to grow and to heal. Sometimes the body makes cells that are not normal, much like the cell on the right of your screen, where you can see that it's quite irregularly shaped, and the center of the cell is also not normal and perfect like the cell on the left side. So these are cancer cells, and they can make people sick. And these are the cells that will cause trouble for you to seek out the care of either your general practitioner, your family practice medicine, your pediatrician, and later on medical oncologists who treat adults cancer, or pediatric oncologists like myself. Cancer cells often grow more quickly than normal cells. Some cancer cells affect our blood cells. Others grow in a lump in our body on different parts of the body, and this lump is called a tumor. A tumor can be a benign tumor where it doesn't spread, it doesn't cause any problems or symptoms, and you may not need to do anything. Sometimes these tumors can be very malignant or cancerous, and they can spread to other parts of the body and can cause serious medical problems and ill health. Let me share with you some cancer statistics. According to the World Health Organization, in the year 2020, almost 20 million people, so both adults and children, were diagnosed with cancer. It would be surprising for you and even for me to learn that almost half of those 20 million people diagnosed with cancer that year reside in Asia, right here. Out of this 20 million, only 300,000 children are diagnosed with cancer across the world each year. So fortunately for us, childhood cancer is still rare. Let's look at the numbers in Singapore. WHO reports all the numbers of different types of cancers in various parts of the world. In Singapore, in 2020, there were about 25,000 people who were diagnosed with different types of cancer. In men, the most common cancer is colon, and the second one is prostate, followed by lung. In us adult women, the most common cancer, not surprisingly, is breast cancer, followed by colon, and then lung. In that same year, right here in Singapore, there were 184 children out of the 25,000 or so people who were diagnosed with cancer were in children. In children, both boys and girls, there was some slight technical difficulty, but we'll proceed on. So in both boys and girls, unlike in adults, the top three most common cancers are very much the same. Number one is leukemia, like what Gary was mentioning. So acute leukemia is the most common cancer in both boys and girls, followed by brain tumors, and then lymphoma and various other solid cancers. This is very similar across the globe. Whether you go to Malaysia, Indonesia, or the US, the top three most common type of cancer in children are leukemia, brain tumors, and lymphoma in both boys and girls. So you can see it's very different from the cancers that occur in us adults. So in men, the most common was colon, and in women, the most common cancer is breast. So that's why when Gary was sharing about your first colonoscopy and your first memo, let's get those done. Those are very important for us. Remember earlier, I was sharing you about some of the cells or cancer cells that affect the blood. So this is a picture representation. In the center of your screen, you see normal blood. Normal blood is made up of white blood cells. White blood cells, subtypes are neutrophils, monocytes. These blood cells help fight different infections, bacteria and virus infections in our body. So we need these white blood cells. We also have lots of red blood cells in our blood. Red blood cells carry oxygen from the lung and distribute the oxygen to the rest of our body, to our brain, our kidneys, the liver, everywhere. And it makes you energetic. We also have tiny cells. They are called platelets. So platelets prevent you from getting a huge bruise if you accidentally bump yourself. Or if you accidentally cut yourself, they prevent you from getting a huge bleed. But when you have these abnormal cancer cells in the blood, just like the picture on the right side of your screen, you see that all these leukemia cells or the abnormal blood cells in the blood, you have all these cells, they crowd out the normal cells. So you don't see many red blood cells on the right side of the picture because the leukemia cells in the blood, the abnormal cancer cells, are pushing out the normal cells. The red blood cells are less, the platelets are less, and the white blood cells are less. So when you have this cancer in the blood, also known as leukemia, when you don't have red blood cells that carry oxygen, you're going to have a child who is not as energetic. They're going to be displaying symptoms of fatigue. They look very pale compared to their siblings or other children in their class. If you don't have enough white blood cells because the leukemia cells are pushing out and crowding out the blood from making normal white blood cells, the child may have persistent and recurring fevers. I'm not talking about fever that, because they go to daycare and there's an outbreak of upper respiratory tract infections or flu virus going on. They will have fever, but they are all very well. So this kind of fever that of concern is very different from that little flu virus kind of fever. They are persistent, they don't go away, and the child may be fatigued, they may look pale, so there are other symptoms as well. If you don't have enough platelet cells, you get these tiny flat red spots on your skin. Sometimes the parents may say that my child has a rash, but it's actually what we call petechiae. They are very different from rash. When you touch the red spots, they are very flat. They are not bumpy, and you can have it scattered throughout the body. These are due to low platelets. You may also have bruises, and I'm not talking about bruises on the shins because a recently discovered child who is able to walk and run, they're going to go run around and fall down. And those kinds of bruises you're going to see on the shin. But when you have an abnormal platelet number, you're going to see bruises in the hidden parts of the body. So like upper arm, on the chest, on the tummy, on the back, on the thighs, not little bruises on the shins. So it's a combination of these symptoms or signs, and something that tells you something is not right is when you need to bring the child to the doctor early so that we can do further investigations and then do the necessary tests and the treatments. Remember, acute leukemia is the most common type of childhood cancer, and it's highly curable with the treatment. When the cancer cells grow as a lump in different parts of the body, they can cause various types of solid tumors. These tumors can be type 1 is benign. So benign tumors grow very slowly. They don't spread to other parts and they hardly cause any problems. So for example, like a fat lump or a lipoma, this is a very benign tumor, and you don't really need to do anything unless they slowly grow over years and they start to hurt, or cosmetically it's really bothersome. that's the time that you take some action to remove it. The other type of tumors or the lumps that grow in the body are malignant or cancerous. These cancers or malignant tumors can spread to other parts of the body through the blood or the lymphatic system, and they can metastasize. So they can spread to the lungs, they can spread to the liver, they can spread to the bone. So these are the ones that need treatment, and these are the ones that can potentially hurt the child or the adult. Some of the most common type of solid malignant cancers in children are brain tumors, neuroblastoma, kidney cancer like Wilms tumor, or sarcomas. These are muscle and bone tumors that I treat as well. Brain tumors are the most common type of solid cancer in children. So the most common type of cancer is acute leukemia in children. So about 30% of the children who are diagnosed with cancer each year are going to be acute leukemia. Then another 30% or one third of the children who are diagnosed with cancer each year are going to be diagnosed with a brain tumor. So this is the second most common type of cancer, but the first or the most common type of solid cancer in children. Let me share with you another journey or another child story. So I have this child who at the age of 7, he was complaining of headaches. He's an extremely studious child. So he studies a lot and he does a lot of extracurricular activities like almost all of our Singaporean children, right? They're very academically hardworking. Okay, so he starts to have headaches, and the parents and he kind of attributed it to doing a lot of work, not enough rest. But these headaches persisted, so the parents took him to the pediatrician, and the pediatrician also thought, okay, maybe this is too much stress, you need to rest. But let me refer you to the psychiatrist. Perhaps there's some anxiety or depression related to schoolwork. So he was prescribed some anti anxiety and anti depression medication. And he took these medications diligently, but the headaches did not get better. It got to be severe. It kept him up. And then now he started to have vomiting symptoms as well. And the parents knew that there was something definitely wrong with their child. And they kept pushing for more tests. And subsequently, a brain MRI was done. And it showed that he had a tumor in the back of the brain, and the type of tumor, which is quite common, brain tumor called medulloblastoma. So this child underwent a successful surgery to remove all the tumor in the back part of his brain. He had radiation therapy and he underwent chemotherapy treatment and completed all his treatment in about 1.5 years. And let's fast forward to now. So he's 19 years old, and last year the parents sent me a TikTok video that they created of his trip to the orientation and his entrance to the dormitory. So he is in university first year, and he's living on his own, enjoying the dorm life away from his parents. So this is a child with a brain tumor who is cured of his cancer and leading a fruitful, normal life. Depending on the location of the tumor in the brain, the symptoms or signs or the complaints that the child may have will vary. So, we have a lot of headaches, and many times a headache is just a headache. But if the child presents or complains of a headache, the first thing I do is suggest to the parents to have a headache diary. When do the headaches start? How long are the headaches? Are there any other symptoms associated with it? So, is there vomiting? So, if you have headache with vomiting, this is not a normal kind of headache. Do you have any weakness on the upper extremities or the legs? So if you have that with headaches, this is not normal. Do you have mood swings? Is there a cognitive decline? Is the child seeing double vision, or diplopia? Is he having hearing problems? Do you observe any abnormal movements or seizures, particularly in one side of the body or a particular part of the body? So it's a combination of all these symptoms that kind of alert you and say, hey, something is not right. I need to see my doctor and let's do something about this. Okay, so I think these are the signs and the symptoms to watch out for. So, in the first story of the 20-month-old that I shared, this child had a tumor that started in the kidney. It is called a Wilms tumor. So, you can see on the left side, the cancer cell starts in the kidney and then it kind of overtakes the whole kidney. So, only when it's huge, you can see the belly being kind of pushed out or swollen or larger. So, you get a protuberant abdomen. Most of the times, there is no pain. The child is very happy and active and playing, eating well, no fever, no aches or pain. It's only when a caregiver is bathing a child that they're kind of soaping the tummy and they feel the hard mass, or they notice that one side of the tummy is not the same size as the other side, or if they go to the pediatrician and then the pediatrician does the exam. So only when you have all this and when you discover this, because the child is acting very normally, that you discover this. So similar to my 20-month-old, you don't really see anything, or you don't, because the child is behaving normally. It's only when you are bathing or palpating that you see a mass. So this child underwent surgery to remove the whole tumor, which also you have to remove that kidney as well. But all the children can grow up to be fruitful adults on one kidney. So the child underwent surgery. Depending on the type of the Wilms tumor cell and the stage, you may need radiation therapy or you may need chemotherapy. So this child has completed all his treatment and he's very happy, the hair is grown and he's very active. Another type of solid cancer that you might come across over social media is a type of cancer called neuroblastoma. Neuroblastoma is very unique and very challenging to almost all the pediatric oncologists because it is very unique in that this cancer can occur in a young child at an age of 3 months or 6 months up to the age of 12 months, and they don't metastasize or spread to other parts, and they may spontaneously disappear, and you don't have to do anything. But the other end or the other spectrum of neuroblastoma, which is the one that we are going to see, or I often see, is the stage 4 or very aggressive neuroblastoma. So, neuroblastoma is a type of cancer that starts off in the adrenal gland. So, adrenal gland on the cartoon picture that I have on your screen is a little gland that sits on top of both kidneys. This tumor arises in that adrenal gland, but it can also travel along the spinal cord. So wherever the nerves are traveling, you can see this neuroblastoma. So it can spread to the pelvis from the adrenal area. You can also see it in the chest, and you can also see it in the neck. Neuroblastoma stage 4 can spread through the blood to attack the bones. So the child may present as back pain or leg pain, or because of the leg pain, they refuse to walk. Sometimes they also like to attack the bones around the eyes. So in the West, it is called a raccoon's eye. So the child may present with two big bruises or one bruise around the eyes. But in Asia, we kind of refer to it as raccoon's eye. And in the West, when a child presents with this kind of a picture, sometimes it can be confused with child abuse. So you have to get a very detailed history about, is there anything else going on? Is there fever? Is there pale? Is there limping? Is there bone pain somewhere else? And then you have to do a thorough exam to find out whether there's any masses on the body. So neuroblastoma can present like this. Much like the brain tumors, solid cancers in different parts of the body, the way that they're going to present depend on the location of the tumor. So in the abdomen, you might have pain, you might have swelling. In the chest, if the mass is too large, you might have wheezing or chest pain, and you can have lumps in other parts of the body. Although the type of treatments we give for cancer are very similar to adults, like chemotherapy, targeted immunotherapy, and stem cell transplant, the way that we treat children, the doses that we give, and the frequency with which we administer the chemotherapy and the treatments are very different in children because children have unique needs and their bodies are very different. They are extremely resilient and they tolerate all these treatments amazingly well and much better than adults. Because of this, we can cure up to 80% of children with various cancers. So if you look at the graph on your screen, the second line, the black color, acute leukemia is the most common. We can cure up to 90%. So the very most common ALL, or acute leukemia, B cell type, we can actually cure up to 98% of children with cancer. For Wilms tumor, the bottom graph, we can actually cure 94% of children with Wilms tumor. So in summary, cancer in children is very different from adults. You have seen that. It is also very rare, but we still don't know the cause of this, and that's why we don't know how to screen and how to prevent. Common illnesses in children are still the more common causes of different signs and symptoms, but if there is a doubt or a question, see your doctor early. Children are definitely more resilient, and that's why I enjoy it and I can do what I do as a pediatric oncologist. And most children who undergo various treatment with cancer do not suffer any long-term damage. And cure rates for cancer in children are reaching up to the 80%. So with that, I would like to thank you for joining us on your precious Saturday evening. And I hope there are lots of questions that we can go through. Thank you so much.
Dr. Ang, thank you so much. That was very, very comprehensive. And you finished off on a high, which is great. As much as we don't like cancer, just to see those survival rates being up there, I saw 70, 80, 90%, like you mentioned, for the leukemia. I think that's really, really wonderful. And also, because I see a question coming through, and you've just mentioned that in your last slide as well, that I guess the side effects or the ongoing effects for children, because you said they're more resilient, right?
Right.
That they do fare a lot better after recovering from cancer too. Is that right?
Yes, it is correct. I mean, compared to adults, because they are very young and their different organs, different parts of the body have not undergone the various lifestyles and the abuses that we have done as adults, they tolerate these treatments much better. But having said that, they do experience some side effects after various treatments. So my 19-year-old who had a brain tumor, who needed radiation therapy to the brain and spine, compared to his younger sister, he is slightly shorter because of the radiation to the spine. So apart from that, in terms of movement, body action, participating in sports, there's no limitation. He is slightly shorter. Also, because he needed radiation to the brain, and the brain has the control center for various hormones. It did affect his thyroid hormones. So he does need to take some thyroid hormone replacements for that. But he can lead a fruitful life in university and get a job after he completes his university and contribute to the society.
Wonderful. Thank you for sharing. And I hope that just gives hope to all the parents out there as well, who may be going through something similar, that, there is light at the end of the tunnel. if you're able to, get in and do the treatment and go through the process and, and speak to your doctor, because I'm sure, like what Dr. Ang has just said, yeah, there may be some side effects, but it's how you can also navigate through them and maybe, tune things up with the treatments and all the rest of it. So, yeah, thank you. So the question too, sort of deviating just slightly from that, is, are there chances of relapse? So thank you, Claire, for the question. Are there chances of relapse in adulthood for some of these cancers?
Yeah. So, yes, there are chances for relapse. So, when we talk about these percentages, right? So, 80% or 90% or 98%, we are kind of mentioning the chance for survival and cure at the 5 year mark. Because
Mm,
for all cancers, whether it's adults or children, within the first 2 years from diagnosis, the chance for relapse is a little bit higher. So beyond the second year to the 5 year, the chance for relapse gets a little bit less and less. And beyond 5 years, we start to consider these children with different cancers as being cured because the survival curve kind of flattens out and the relapses are almost not existent. I wouldn't say zero, but they are near not
that's
existent.
yeah, that again, and it's warming and I guess reassuring to hear that, and especially with those high numbers as well. I think that helps too. There's another question that's coming in. Are there any groups of children with higher risk of neuroblastoma or any other particular type of cancer?
Yeah, so there are no known risks for children getting neuroblastoma. We still don't know why they have them, but there is a familial cancer syndrome. So there is something called a Lee-Fraumeni syndrome, where the gene P53 is kind of mutated. So if when I see a child with a cancer, even though we don't know the cause, I always get a detailed family history. So in families with this familial cancer syndrome called Lee-Fraumeni, you might hear of an aunt having breast cancer, an uncle having a colon cancer, another uncle having a sarcoma, or something like that. So there is some familial predisposition, but it doesn't kind of dictate to the child getting the neuroblastoma. It's just that there is some predisposition in the child to getting a various type of cancer.
Okay, thank you. And in terms of the, I guess, other, lifestyle choices, I know that you said that, it's not that children have done anything wrong or something that have created their cancer, but is there, maybe one or two sort of big takeaways that you can just give our viewers as to what we can do from a preventative sort of lifestyle that we can just add in, tomorrow, start tomorrow, Sunday, and, try to reduce any risk at all?
Yeah. So I think there are a few preventable cancers. So hepatitis B vaccine. So it's important we get these vaccines during childhood, and sometimes we need boosters as adults. The vaccine is available, so you should get vaccinated with hepatitis B because you can get um, hepatocellular or liver cancer from having recurrent hepatitis B infection. So that's one preventable vaccine. The other preventable vaccine is HPV vaccine for cervical cancers. So those are vaccines that I do encourage the children to have, or the parents of the children to vaccinate the kids against this. In terms of lifestyle, um, I think that you can start off together as a family to eat healthy food, healthy nutrition, not so much processed food, lots of veggies and fruits, so that you can lessen your risk of developing a cancer as an adult. So, like a colon cancer as an adult. It's not going to occur as a child, but I think these are habits that are important to start off when the child is young.
Wonderful, thank you. We have another question about treatment. So, can you share, how long treatment is typically required for?
Okay. So the treatment kind of depends on the type of cancer and the stage. For ALL, for example, the most common type of cancer in children, acute leukemia, the intensive treatment is the first 6 months. The first 6 months, the child is in and out of the hospital. They're at very high risk for infection in the blood and getting very sick. And after that, the treatment is less intensive. You start to see the child growing hair back again, and they start to be able to return back to school. But the whole treatment for ALL spans over about 2.5 years. So it's a long treatment, but only the first 6 months or so is the really intensive part where they are not able to go to school. And the rest become less intensive, and there's a maintenance kind of phase where the children usually just take oral chemotherapy medications, and you really cannot tell that they are on chemotherapy treatment because they look just like their sibling or the next child in class. So that's for leukemia. In the child who had the medulloblastoma brain tumor, the treatment spanned about 1.5 years. So in the child that had the kidney cancer, it's only 6 months, and it's outpatient in the clinic every week, kind of a short chemotherapy. So it varies depending on the type of cancer and the stage of cancer.
Yeah. And so are there, different treatment options? Like, can you try one, or if that doesn't work, try another? Like, is it
Yeah.
fluid in that sense, or, is it kind of...
Not so fluid because children cancer is really rare. So in the US and Europe and in Asia, many pediatric oncology centers or pediatric oncologists come together and formulate clinical trials to see which is the best treatment for that particular type of cancer and that stage. So there are standardized treatment protocols across the world for a very specific childhood cancer type and stage. And we all kind of follow these standard treatment regimens because they are all proven with a track record for high cure rates. So we do this as a standard treatment only if the cancer relapses third or fourth or fifth or sixth time, then there's no more standard treatment, and we kind of personalize the treatment to the child with the latest evidence in the scientific literature.
And I hope that doesn't happen too often, that
Yes.
we need to end up at that stage. Yeah.
Yeah. Thankfully, not very often.
Wonderful. Are there any other questions? If you do have any questions, again, feel free to chuck that in the comments there. Thank you, Claire, for asking a couple of questions as well. I just have one last question. I know it's sort of been covered a little bit, but besides the nutrition and that sort of thing, and what you've shared a lot of the symptoms, and sort of just for us parents, taking note of maybe some changes and difference in headaches or fevers. But are there any other specific risk factors that you can share with us that we could also take note of that may contribute more to the childhood cancers?
So that's a very good question, and I'm kind of stumped right now as to because
I'm so sorry. I
think
mean,
that
for adults, it seems it's a bit more straightforward, and there are maybe more lifestyle factors that will increase our risk of getting cancers.
So
I'm curious
because
if kids are the same.
so because in terms of lifestyles, right? In adults, it takes years for us to misbehave and do this lifestyle before we run into trouble. But
Before
in
our body
kids, right? Like
hates
a
us, right?
20-month-old or a 22-month-old or a 7-year-old, they haven't done much in terms of lifestyle to harm themselves. So it's a good question, but I don't think I have the answer.
No problem. So in line actually with what we're saying, Claire's just sort of asked, well, does childhood cancer have anything to do with genetics? And I know you mentioned just now about the that specific strain. If you see sort of your relatives having some cancer, that you may also just want to get checked. But that,
Yeah.
even if that were the case, that doesn't guarantee that the child or an adult will get cancer, right?
Right, absolutely right. And I think it can that screening for that gene can definitely cause anxiety because you can't prevent it if it's and you don't know whether it will happen or not. And most of the times nothing happens, right? But it just causes anxiety with that.
So
So
is it almost right to say then ignorance is bliss, and unless really sort of necessary, do you add this level of stress to your life? Because I mean, stress itself can also trigger and cause health problems, cancer maybe being one of them as well, right?
uh, so I think after having taken care of kids with cancer for so many decades, I think that enjoy life, do lots of things together as a family, lead a healthy
Mm.
lifestyle so that you can prevent certain diseases and problems as an adult. Uh, but yes, sometimes ignorance can be a bliss. But if there are warning signs or there are question marks in your brain, seek advice from a medical professional.
Yeah, definitely. And I 100% agree with that. And I couldn't have said it any better. Love life, enjoy it, spend time with the loved ones. Don't wait till something bad happens before you go, oh, let's, cherish what we've got. So do it right now. Because, even if it's not cancer, it could be another health. Unfortunately, there's a lot of health conditions and issues, and even just like chronic headaches or backaches that make us moody and upset and not wanting to spend time or take a walk with our family. I mean, all of this can be avoided too, I think. So yeah, I think
I,
it's time that we should cherish what we've got and also do what we can now while we're healthy, right? To
yes,
keep
I
our health.
totally agree.
Awesome. All right. Well, if there's no other questions, and if you do have any questions, just drop them in, and we'll definitely try and answer them and get back to you. But I don't see any more right now. So, Dr. Ang, I just want to say thank you so much for your sharing tonight. It has been very detailed, but also very valuable. And I hope people have been able to take some notes and screenshot some of those signs and symptoms, those early detections that we can sort of get in and get it checked out sooner.
Thank you so much, Gary.
Not a problem. Have a
And also,
wonderful Saturday evening and weekend.
thank you. You too.
And thank you so much. And I will now just say thanks again, and I'll let you take your leave.
Thank you.
Wonderful. So that was very, very valuable. And I'm so glad to hear that, there is good treatment options out there for childhood cancers. Before everybody goes tonight, can I please just get one moment, not even 1 moment, 30 seconds of your time? We would love to get some feedback from you for this session for our Facebook Live. What can we do differently? What can we do better? What other topics do you want? We want to be able to tailor this to serve your needs. So if you can, please take out your phone, or if you're on your phone right now, just screenshot this and head over to, actually, it should be in the link as well, in the comments, sorry. Click on the link in the comments and just give us your feedback. Just spend a minute to do that right now. And as you're doing that, I'm just going to let you do that. But I will also just recap a couple of our upcoming events. So you don't have to look at the screen. You can be filling out that feedback form. But just a quick reminder of the upcoming events. The first one is our next 365 Live. That is going to be on the 9th of March, right here, same time, same place. And this will be about breast cancer, which is just fitting, seeing as International Women's Day is on the 8th. And of course, we have our campaigns that we're running. The Bloom for Hope is coming up really soon. So please go and check that out. That's again at our Tampines hub on the 2nd to 3rd of March. So please go look for some information, register for the event. Again, the website is pinned in the comments, but you can also check out this on any of our social media or websites. And of course, the last two campaigns, the important ones that even Dr. Lele mentioned, we can proactively look after, is our colonoscopy and mammograms. So if you do have a blue or orange CHAS card, this may be for you fully sponsored. And for those who would love to help sponsor these people, please do also take your QR codes, or should I say, take and scan these QR codes. And any donation, small or large, is going to go a really long way in helping, this world to be healthier and for people to get the treatment and the support that they need. All right. So thank you once again for being here this evening. Please do like and share our social media pages and keep in touch with us for the latest updates and for our events, such as tonight, this 3-6 Live event. So once again, thank you so much for joining me. My name's Gary, and I hope to see you all in the next session. So until then, take care, stay safe, and as we discussed, go and enjoy life now. All right, have a good night.